Glucose is a simple sugar found in carbohydrates and natural sweeteners. After eating carbs or sugar, glucose can be found dissolved in the blood. Glucose is also the body's most important energy source. Insulin is a hormone that helps the body utilize glucose. It allows glucose to pass from the blood through cell membranes to the inside of cells where it is needed for cellular metabolism. The presence of insulin also discourages the release of too much stored glucose from the liver or body fat back into the bloodstream because too much blood sugar is not good either. The pancreas is an organ, an elongated, spongy strip tucked in behind and below the stomach adjacent to the liver. It has a dual function. Part of its function is to produce enzymes that aid digestion, but it also produces several hormones critical in body metabolism, including insulin. There are islands of hormone-producing cells scattered throughout the pancreas. These islands, called islets of Langerhans, contain the specialized cells that produce several hormones. Glucagon, which increases blood glucose, insulin, which facilitates glucose movement into the cells from the bloodstream, and somatostatin, which inhibits the secretion of glucagon and insulin. The cells within these islets that produce insulin are called beta cells. In diabetes, the body produces an inadequate amount of insulin, or even no insulin, because the beta cells are damaged or destroyed. The body's cells are starved for glucose, while glucose in the blood remains high. There are several kinds of diabetes. The two most common types are diabetes type 1 and diabetes type 2. In type 1 diabetes, the body's cells are starved for glucose, while glucose in the blood remains high. This type of diabetes is usually discovered early on in childhood. Treatment requires the injection of insulin throughout the day. In hyperinsulinism, which can be a precursor to type 2 diabetes, insulin is present, but the body is resistant to the insulin. In fact, the body responds to insulin resistance by producing extra insulin, more than would normally be found. But again, the body is resistant to this insulin, and so both insulin and glucose remain high in the blood. In type 2 diabetes, usually seen in adults, the body produces some insulin, but the body's cells do not respond to the presence of this insulin. Not enough glucose gets inside the cells, and again, high blood sugar, also called hyperglycemia, results. Oral medications are most often the first line of defense, particularly in the early stages of type 2. In the later stages of type 2 diabetes, the pancreas produces markedly less insulin, which may mean the patient has to inject insulin now to manage the disease. In these later stages, weight loss can occur, despite hunger and high food intake. As mentioned previously, because diabetes prevents cells from metabolizing glucose, you can actually have severe body wasting or even become comatose if it is left untreated. But long before that, diabetes is still dangerous because hyperglycemia over time damages the kidneys, the circulatory system, inhibits the ability of wounds to heal, and damages your eyesight. With diabetes, hyperglycemia, you can lose your kidneys, your limbs, suffer from non-healing ulcers, and lose your vision if the diabetes is not well controlled. Diabetes can also cause painful nerve damage, strokes, and heart attacks. So what does obesity have to do with diabetes? Obesity is strongly associated with type 2 diabetes, the insulin-resistant kind of diabetes. So what are the other risk factors for diabetes? Genetics plays a role. Diabetes tends to run in families. Age, race, and ethnicity are also factors. Asians and African Americans have a greater risk of diabetes, and older Americans are at an increased risk for diabetes. But the biggest factor in insulin-resistant diabetes today is obesity. According to the American Diabetes Association, 80% of all type 2 diabetics are obese. Type 2 diabetes and obesity go hand in hand. Why is that? We all know that fat stores energy for our body, but less well known is the fact that fat is the body's largest endocrine organ. That means it stores and releases hormones too, just like the thyroid or the pancreas. Fat releases hormones which, among other things, encourage hyperglycemia. And fat also decreases the body's sensitivity to the insulin. The decrease in sensitivity to insulin is because too much fat means too much fatty acid in the blood, which in turn damages insulin molecules and makes them less effective. Just to make things worse, obese individuals tend to suffer from systemic inflammation, which both increases insulin resistance and damages the beta cells of the pancreas. Symptoms of diabetes include increased thirst, increased urination, and increased appetite, as well as fatigue, blurred vision, and, in advanced cases, weight loss. If you are experiencing these, you should see your healthcare provider. He or she may check your blood sugar. If your fasting glucose level is greater than 125 milligrams per deciliter, then you may be diabetic. Type 1 diabetes symptoms tend to appear suddenly, whereas type 2 diabetes can begin its damage for months or years before symptoms are noticed. That is why a blood glucose test should be part of a regular checkup. If your healthcare provider determines you have type 2 diabetes, you may be given a prescription for oral medication, or you might have to use insulin, which is injected. Oral medications are often tried first, especially if the diabetes is not severe. If your fasting blood sugar is in the range of 100 to 125 milligrams per deciliter, you may have a condition called prediabetes. If you have prediabetes, consider it a wake-up call. It is possible you may prevent full-blown diabetes and all its complications by controlling your diet and adding routine exercise to your regimen. With prediabetes and even mild diabetes, it is often possible to attain healthy blood sugars by diet and exercise alone without medication. That's the best news about diabetes and obesity. Reduce the amount of fat in your body, and you might prevent heart attack, high blood pressure, stroke, sleep apnea, improve your strength, immune system, and mood, while preventing or improving type 2 diabetes as well.